Hey everybody, it's Dr. Dave, Psychiatry. Thanks for on the YouTube channel today. Today I'm going to do the first in a series of what I'm going to call product-specific videos. So today we're talking about Prozac. The generic name for Prozac is fluoxetine. Most people have heard about Prozac. This video is not all-encompassing. If you need to read more about it on the internet, obviously there's tons of places you can go on the universe of the internet and read about Prozac. So this is more about my experience with it, how I use it, how people benefit, the very specific aspects of what I'm going to call Prozac, which honestly is generic fluoxetine. If you're getting it today, you're not getting the brand name. You're getting fluoxetine. But I talk about Prozac as synonymous. It's the same thing. Now, there's a lot of opinions out there on the internet, apparently, about what Prozac is and what isn't, and what it's good for specifically, and things of that nature. If you've watched the videos of the previous videos on this channel, you understand that the most important thing of picking a medicine is if it works for you. I've talked about locks and keys and talked about the troubleshooting method. And really, I don't think there's any real way, there's especially no genetic way, even though there are tests out there that imply that, there's no genetic way to say that you as an individual are going to benefit from Prozac until you try it. So what's the picture of Prozac? What do we use it for? Well, it's serotonin shortage. What does serotonin shortage look like? Well, the word for it is called depression. And the symptoms of depression, as you already probably know, is depressed mood, low interest, low energy, hopeless, helpless, can't concentrate, not eating well, not sleeping well, thoughts of being dead. So when we see that picture and the concern is for low serotonin activity, then medicines that boost serotonin are the useful tool. So Prozac was actually the first modern, what's called an SSRI, which stands for selective serotonin reuptake inhibitor, a term that I don't use anymore because I just talk about boosting serotonin. So Prozac was the first modern serotonin booster. And the reason it was revolutionary is that this is back in the 1980s. The previous medicines that we used, called the tricyclic antidepressants, and these were medicines that were used to treat depression before Prozac was invented and tested and released by the FDA for approval for treatment of depression in the United States. Tricyclic antidepressants helped a lot of people, and we still use tricyclic antidepressants. But tricyclics have one major problem. If you take all of your monthly supply of a tricyclic antidepressant, which might be a medicine like nortriptyline or Elavil or protriptyline, those medicines, when taken in high doses, are lethal. So when I was working in the emergency room as a med student and a resident, it was actually very common to get an ambulance call that someone was being brought in having overdosed on their antidepressant. And if that was a tricyclic antidepressant, that was a very scary, life-threatening thing. We had to do lots of medical stuff to prevent death in those circumstances. Prozac, by contrast, is not lethal in overdose. So that's really not a concern we have. If you took your entire month supply of Prozac, your stomach might hurt, you might have some diarrhea, but you're not likely to die. And that was revolutionary. So now we're able to take patients that in prior generations had been treated for depression, literally in locked buildings, psychiatric wards, and then we could really relatively safely treat depression for outpatients. So people would drive to the office, get a prescription, drive away, take their medicine, work, have normal lives, and we didn't have to worry so much about what would happen if they had an overdose. So this was really revolutionary, and why Prozac, fluoxetine, really was a game changer in the landscape of treating depression. Well, one of the things that happened in the early 90s is that some voices, and the names of the people don't really matter, the names of organizations don't really matter, but it was alleged that Prozac made you kill yourself or made you kill other people. So there were forces out there, I think, that were either psychologically or maybe financially competing with the idea that Prozac would help depression and help people get better. So maybe people didn't need their self-help program. Maybe people didn't need the 6 month of going to a mental rehabilitation center. Maybe they didn't. There were lots of people doing stuff that were sort of, I think, in some ways, maybe honestly trying to treat depression. In other ways, I think we're just bilking people out of their money. So the people that were financially maybe being damaged by the advent of Prozac, well, I think that's a hypothesis of mine, but I think there's a lot of evidence to support it, that people were trying to scare other people away from using Prozac. And the allegation that it makes you kill other people or kill yourself is simply not true. Now, we know that depression kills people. We know that people that are depressed and hopeless and don't care about life and they just would rather be dead than be alive, sometimes they will take the final action against themselves, and that's what causes suicide. And if you haven't watched my video on suicide before, you should probably watch that, because I talk about in depth about that issue. But really, we know that Prozac does not cause suicide. We know depression causes suicide. So if someone is scared away from their medicine, scared away from their Prozac, because somebody says, hey, that might make you kill yourself or might make you kill somebody else. Well, if they're scared away from it, then it's more likely that they might die from it. So people that were scaring people, or attempting to scare people away from Prozac, that was a very negative thing that happened. And the voices sort of went away. Today, it's really not a prevalent thing. Today, it's not a prevalent thing that people are actively trying to scare people away from Prozac. There may be people that would say, hey, you should take Prozac only in an emergency, that really you'd be better off taking a 60-minute walk, or you'd be better off just taking some vitamins. Well, the people that say that, typically they might be patients, and they might be people that sell vitamins, but they're typically not people that deal with depression on a day-to-day basis like I do. So what I know in my office is that people have already, exercised. People have already done the walking routine. People have already improved their diet. People have already taken the supplements. Well, if they still come to me, and after a month of being on a medicine that boosts their serotonin and their symptoms are gone, well, that's my evidence for the fact that it works. And having done this for over 30 years, I tell you, in patients that have serotonin deficiency, as long as the Prozac is the right tool for their body, they don't have major side effects, it is absolutely restorative to their serotonin and can eliminate the symptoms of depression. That's the only reason anybody would take it, would be to eliminate the symptoms of depression. I should backtrack a little. There are other diagnoses that we use Prozac for. Maybe I should talk about that a little bit. Prozac is also very useful in the condition we call obsessive compulsive disorder. I don't really know why. Serotonin boosting, really in theory, obsessive compulsive, when you can't shut your thoughts off, you're thinking too much, worry too much, can't stop thinking about something. My first line of thinking would be that dopamine suppression would be more helpful, because dopamine in my office is the thinking chemical. If this is the normal range of dopamine, if you make too much dopamine, you'll think too much. And so medicines that decrease dopamine logically would be the ones that I would go to first for people that have obsessive compulsive disorder. Obsessive compulsive disorder, a intrusive thought that you don't like how you think about it, it bothers you, can't get the thought out of your head. And sometimes it causes you to perform behaviors that you don't want to behave, just because, like, I don't like that I have to check the lock 20 times just to get out the door. I don't like that I have to say the Lord's Prayer 17 times just to leave the house. Those behaviors get in the way of normal life. So OCD is a bad condition, and you would think that dopamine suppression would be the frontline treatment for that. And I do that a lot of times with my patients. I will actually start with dopamine suppression. But Prozac, even though I don't believe it's officially FDA approved, Prozac is a very useful tool for treatment of OCD. Now, the interesting thing about that is that Prozac at low dose typically doesn't do a lot when patients that have really bad OCD. Patients typically need higher dose. So the dosing notches, we're talking about the dosing notches about medicines. For Prozac, it's 20, 40, 60, 80 milligrams per day. Prozac is typically always taken in one dose in the morning. So if you're taking 20 milligrams in the morning, and if we increase it to 40 milligrams, it's typically just all at the same time in the morning. Same with 60, same with 80. In this group of medicines, which includes Prozac, the typical rule of thumb, the rule of thumb that I use, is at least one medicine, at least the medicine Prozac, at least 1 month, at least one dose. So you can go longer. Typically, the way I view it is that you get about 60% of the benefit of the Prozac in the first month, and you get the second 40% of improvement in the second month. So if you want to go to 2 months, that's great, but I will increase the dosage from 20 to 40 or 40 to 60 to 80 after 1 month if patients are having severe symptoms. So if someone's doing that for you, don't be surprised, that's not abnormal. What you don't want to do is be on Prozac 20 milligrams for 6 months. If you've been on it for more than 2 months, that's what you're going to get typically. So I see a lot of patients in my office that have been on Prozac. They'll come and say the first visit, they'll say, yeah, I've been on this for 2 years at this dose. And my first thought is, gosh, I don't want to say this to them out loud, but we just lost about over a year and a half. because typically, and you're working with somebody who is aggressive and knows what they're doing, it is not unsafe, and it's the way to not waste time. The balance between not going too fast and not wasting time is at least 1 month, but no more than 2 months. That's the rule of thumb with Prozac that I use. Prozac is easy to take. It's typically well tolerated. There's a couple big areas of side effects. Prozac a lot of times will cause stomach discomfort, gasiness, diarrhea sometimes. I believe that's because serotonin is really made in 2 places in your body. And if Prozac boosts serotonin, well, it boosts in your brain, but it can also boost in your gut. So if you have serotonin boosting in your gut, that can cause nausea, gasiness, flatulence, and diarrhea, things that you don't really want to have. When those side effects are mild, then we ask people to stay with it, because a lot of times after a week or 2 of being on the Prozac, that will improve. If it doesn't improve, then you might need to change the medicine to something else. If you have severe side effects, like you're allergic to it, fever, rash, any of that allergic type stuff, obviously you're not going to be able to take it. And your doctor, as soon as you have an allergic reaction to Prozac, you tell it to your doctor. Doesn't necessarily mean that you're allergic to other medicines that boost serotonin, but it's good to know. The other major side effect of Prozac was something that was embarrassingly to me. I didn't really recognize it early off in private practice, and I had some doctors ask me directly this question: what do you think about Prozac and sexual side effects? Well, I honestly answered the question because I hadn't been in practice that long. I said, I don't see that much of it. Well, after 30 years, I was wrong. I know now that sexual side effects is actually a big thing with Prozac. It's a big thing actually with any of the medicines that boost serotonin, and what we know, and I've talked about the sexual side effects in other videos, but what we know is that Prozac can decrease your ability to finish. So in polite terms, there's the getting ready, which is the preparation for sex part. There's the act of the sex part. There's having sexual ability, and there's the ability to finish, which is some people call climax, but the ultimate ending of the sex act. Prozac is pretty well known to delay the ultimate ending. Now, is that useful to some people? It actually is. Sometimes actually urologists use Prozac to delay ejaculation in people that have premature ejaculation. So if you finish too quickly, then Prozac sometimes will help fix that problem. But for people that you just cannot finish, it's very frustrating and they don't like it, and so they end up having to try a different medicine. That type of side effect, if it's happening and it goes on for more than 2 or 3 months, honestly, the answer most times, if Prozac's doing that, we got to find a more cooperative serotonin booster. So that might be the other names that we'll talk about later: Zoloft, Lexapro, Celexa, medicines like that. Getting off Prozac is pretty straightforward, because Prozac is what I call the only self-tapering antidepressant that I use. Prozac as a serotonin booster has the initial form, which is fluoxetine, and then when it's in your body, it gets metabolized and broken down. And the first breakdown product of Prozac is also an active serotonin booster. So the moment you stop taking Prozac, you've still got it circulating in your body for, say 5 or 7 days, whatever the half-life is. I'd have to look it up. But you also have this thing that's called an active metabolite, which means it's still doing the serotonin boosting thing that the Prozac did. And because you have that active metabolite in your system that drains out over about 3 weeks, it really takes about 3 weeks for Prozac to get out of your system. So Prozac is the one that we use, that when we're switching from one to another, we don't really have to worry about tapering, just because of the active metabolite. So self-tapering Prozac, getting off Prozac is relatively easy. Little coverage of the alcohol issue, which I've talked about before. Doctors always say don't mix alcohol and medication, and we know that patients do that. It is like all the other medicines that boost serotonin, all the other psych meds that I use, basically. If you drink alcohol on Prozac, the alcohol is likely to have an increased impact. So 1 beer might feel like 2, 2 might feel like 4. 1 glass of wine might feel like 2, 2 might feel like 4. So if you are going against recommendation and you're having a beer or having a glass of wine, especially if you're driving, you got to understand you can't drink and drive. You can't drink and drive with this medicine. If you're normally very cautious, you need to be even more cautious than you normally are. That's about all I have on the topic of Prozac. I appreciate you coming to the channel. I hope this is helpful to you, and I look forward to doing other product-specific videos about medications to help with how you think, feel, and behave, whether it's for you or someone that you care about. I'm Dr. Dave, Psychiatry. Thanks for coming to the channel today. Thanks for coming to see me. We'll see you again.